Well, I guess we're at the end, and that's good. I just want to thank you all and all the speakers for your insightful comments today. They were thoughtful and clearly gave us a direction as we pursue legislation and working with implementation of the Affordable Care Act in the upcoming session. I think this is a great start for all of us today, and I hope this will become a continuous conversation. Since we gathered today, there has been a decision, I guess, by the governor and a release by the governor that we will have a state and federal model. And what I want to say as a Commerce Chair in the State Senate is that we can work with that plan. I believe that we can provide access to those 150,000 uninsured Iowans, and we can reduce the costs throughout the system. But we need to be included in the discussions that will occur about how to put this exchange together. And we need to include this network of providers, workers, and interested parties to make this an effective program for the state of Iowa. There's a great deal to be accomplished, but we can do that if we all adhere to what we know are the best practices and recommendations of the Affordable Care Act. And we are committed to that, and we need to put together a model that all Iowans can be proud of. And from the Senate perspective, and I just want to say, you know, this really should be bipartisan. And I'm disappointed that that despite our invitations to our colleagues, our Republican colleagues, they chose not to be here today because I think what was stated pretty clearly today by all the parties here is we have the same goal: to provide insurance for the uninsured and to reduce the costs in the system. And I think that's something that both Democrats and Republicans should be on board for. So thank you for being with us today, and thank you for your thoughts. Amanda.
Yep. I have to adjust that microphone. Thank you again for attending today and being so patient through this entire hearing. And I just want to go a little off of what Matt said, or Senator McCoy said, talking about the inclusiveness. And I think this was a great start. This is a beginning, and we will have many more of these dialogues. But we saw a wide variety of providers and advocates that certainly were here to talk about, you know, whether it was cost savings, quality of care, transparency, location, access, and variety of providers. I think we have a great start. I appreciate all the legislators too that came today to. You know, sometimes people avoid coming to human service things, but it is great to see that many people come and participate, especially this busy time of year. So again, this is the beginning of a dialogue. I think Senator McCoy made it very clear that we'd like to be inclusive, and we have invited our counterparts in both in the House and in the Republican Party, as well as the governor's office. So I would like to think that we will include them at every other moment that we provide these opportunities.
I, along with my colleagues, want to thank the people who came here today and for your succinct and clear message to us. I want to also acknowledge that Senator McCoy and Senator Reagan, along with others in the Senate, will be taking a leadership role in implementing the various initiatives that the Senate Democrats will bring forward, that we will try and hopefully get bipartisan support with our colleagues in the Senate. I'm particularly intrigued with the number of House Democrats who came and are attending as well. As a minority member of the House, they're not going to let that status prevent them from, I think, implementing what they feel is right. And we'll look for their membership and their leadership in the House to take forward this message. I think it's extraordinary, the large number of people who came here today that had the same message. Expanding Medicaid, implementing a state-based exchange is essential for citizens of Iowa to fully implement the ACA. We hope that we have the politics of the Federal Health Insurance Initiative out of the way, that the Supreme Court and the election made that very clear. My colleagues also were very gentle in how they explained that we wished and that we had our colleagues here from the Republican side of the aisle. Actually, to be transparent and fair, we asked our corresponding chairs of the House to be here today and to co-host it. They had agreed. Only until the governor got involved and asked them not to co-host it did that change the dynamics. We have to understand that we do not, under any circumstance, believe that making this a partisan issue will help achieve the ultimate end. And so I'm going to ask you, all of you, to reach out to the counterparts in the House and Senate and engage them in discussion about what this means to you, to your consumers, to your participants and constituencies. It's not about us, it's about them. And we heard from a wide variety of providers today and advocates needing and insisting that this be an Iowa-focused exchange and an Iowa-focused expansion of Medicaid. Anything less of full implementation, the consequences will be disastrous for Iowans. This is not a political issue. It shouldn't be. So we're extending out to our colleagues again, sharing them all of your comments, your written material, so we'll be able to have them understand a little better your passion and your need for the things you brought to us today. And I'm sure that with the implementation of the Iowa Insurance Exchange, that the governor has said he wants to participate or develop in Iowa, he's acknowledged that he's already defaulted to a federal exchange. Now, we will have legislation, and it will be in Senator McCoy's committee, to establish a state-based exchange in 2015. We're too late to have anything in 2014. The best we could hope for is a federal-state partnership. The governor has agreed to that. So we're very excited to be able to work with him to create an exchange that Iowans need and can use in preparation for a state-based exchange in 2015. Thank you very much for coming, and we'll stay around along with my colleagues if there are any other questions you might have. Thank you.